Hello everyone, today's video is about using high-dose MSM for SIBO, and it's also about just some of the little nuances a bit between different subtypes of SIBO, or maybe lack thereof nuances. We'll see how the video goes. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I interviewed a fellow naturopathic doctor named Dr. Kathleen Janelle a number of months ago. I guess it was last fall, actually, fall of 2024, I think it was. And there was a question that was posted on our podcast episode, which was posted as a video as well on YouTube. And so it goes a little something like this. So MSM works for hydrogen SIBO, question mark. I heard in another video that it works best for more bloated, constipated SIBO patients, but that is always said to be more the symptom for the methane SIBO patients. I have always been confused because I have hydrogen SIBO and have the bloated, constipated symptoms, which are usually described as the symptoms for methane SIBO. I'm hoping that hydrogen SIBO, I think maybe treatment could work for me. So thank you for the question. So in my experience, MSM is, as far as digestive related issues go, MSM tends to be one of the things it's best at doing is helping with reducing bloating symptoms. And that could be just reducing bloating in general, or that could be reducing bloating that's associated with eating certain foods, or sometimes just eating in general, because some folks seem to react to just about everything that they eat. So yeah, bloating reduction is high on the list. But that being said, I have seen high-dose MSM, which, just to clarify, is the therapeutic benefit seems to be related to the sulfur content, so it's really a high-dose sulfur therapy protocol, but we tend to use MSM as the supplement of choice to get that sulfur into the patient. I have seen high-dose MSM help to resolve symptoms of constipation. I have seen it help to resolve symptoms of diarrhea. I have seen it help to reduce or eliminate nausea and just kind of random abdominal pain. And then in general, I've seen it work to, from as best I can tell, work to help heal up the gut lining and just kind of reduce symptoms in general, or putting it another way, but also seen it to work as an agent that allows patients to expand their diets more and also not be stuck taking certain supplements, whether that's typically antimicrobials, but maybe on other, gut healing supports. Like I've had patients who have been kind of stuck taking glutamine for years, and when they come off of it or lower the dose too much, the symptoms come back. They go on MSM, and they can sometimes come off of the glutamine and then eventually come off the MSM or get down to a maintenance dose of MSM. So I've seen it do a lot of different things for a lot of different patients. So I definitely wouldn't say that high-dose MSM / high-dose sulfur therapy is pigeonholed, so to speak, for hydrogen SIBO, like hydrogen gas-producing SIBO specifically. What I can also say is that I don't have any patients to date that I can think of off the top of my head where we have used high-dose MSM. So let me start again. Where a patient has a positive lactulose breath test, along with symptoms, we put them on high-dose MSM. That's as the only intervention, and then we retest after, say, a couple of months and see how it impacted their SIBO levels. I cannot think of a case where we've done that, because I don't think that we have, at my clinic at least. There might be folks out there who have done that, and if you know of them or you're a patient where you did that, please let me know. I'd love to hear what that outcome was. But generally, I use the MSM as a adjunct to the antimicrobials, or patients who have SIBO. They've done everything under the sun. They still have symptoms. We put them on MSM, and then that helps their symptoms further. So honestly, I don't know how effective MSM might be at helping to treat SIBO itself. I think as a gut healer and an anti-bloating agent, it seems to be quite helpful. Now, how does it work from an anti-bloating perspective? I don't know that mechanism has been elucidated, whether it's because it's helping to act as kind of a prokinetic, whether it's helping to eliminate constipation, whether it's acting as an antimicrobial, whether the sulfur has some type of a carminative effect, like gas reducing effect. I don't know, to be honest, because I'm not sure that anybody's ever talked about that or elucidated that, but clinically it works in many cases, so it could be a really great tool. So I don't know that it works for any type of SIBO from a killing perspective, because I haven't had the opportunity or made the opportunity to investigate that, but it would be nice to know. I did also want to just mention in this video, just since it was kind of alluded to or referenced here in the question, not that it was a specific question, but just where the individual who posted this said, I've always been confused because I have hydrogen SIBO but have the bloated, constipated symptoms, which are usually described as symptoms for methane gas-producing SIBO. And so that's something that kind of flummoxed me, confused me for quite a while too, because I did my training, did most of my learning from Dr. Alison Seebecker, brilliant naturopathic doctor down in the States. She put out a lot of, she was a very prolific author, teacher around all things related to SIBO. Then there were SIBO conferences that were happening annually leading up to COVID. So, attended all of those, either virtually or otherwise. And then just lots of other, maybe not lots, but there's several other docs out there, like Dr. Pimentel and others who, lecture about this. So I gobbled up as much continuing education as I could around SIBO over the years. When I first started practicing, or sorry, I should say first started treating SIBO, which is maybe a few years into my practice career, when I learned about it, I was like, oh, like I've got patients who have what I figured it was going to be, they have all the constipation and bloating and everything, and they tested positive for hydrogen, and then patients with diarrhea tested positive for methane. It's like, what gives? Like that's not quote unquote supposed to happen, but yet it does. And I've certainly found that patients with SIBO, yes, they can trend towards certain symptom pictures based on the SIBO type, and that does play out oftentimes, but not always. So I've had plenty of patients with hydrogen gas producing SIBO that are constipated, and plenty of patients with methane gas producing SIBO that are have diarrhea. All manner of patients with SIBO can have bloating, so it does not seem to be like there's no hard and fast rules. Now, whether that's because there's other concomitant things going on at the same time, maybe they have this type of SIBO, but they also have yeast overgrowth in their large intestine, or they have bacterial overgrowth in their large intestine, or there's parasites at the same time, or they have exocrine pancreatic insufficiency at the same time. Like there could be these comorbidities, these concomitant variables that are going on. So I think it becomes very tricky to make kind of generalizations around different types of SIBO being associated with different symptoms, because there could be comorbid factors at the same time. So just wanted to speak to that quickly as well. I think I will leave it there for now. If you wouldn't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. If you have any questions about SIBO or any other topic related to digestion, complex chronic illness, life of the universe and everything, feel free to post in the comment section below, and I will do my best to answer as soon as I can.